How was that?
Perfect.
Okay. Thank you all so much for having me today, and aloha from Hawaii. This is really inspiring because we're at the beginning stages. I'm looking at co-location, and so it's been great for us to hear the three panelists before me, and I'm looking forward to following up with all of you to learn from other states. So I'm Kerry Urosevich, and I am the lead for Network Design and Innovation with the Early Childhood Action Strategy. We're a collective impact effort that works on the system of care for Hawaii's youngest children, or keiki. You'll hear me use that language throughout the presentation, and families. We started in 2012 within the Executive Office of Early Learning up in Governor Abercrombie's office. And we stayed in state government for about 4 years, and then we pulled the effort out of state government. But we still work very closely with all of our government partners. Just a little bit of background on Hawaii's keiki and children birth to 5. So we have about 108,000 children. 50% of those, which is relative to the topic today, are 3 and 4-year-olds, or 50% of our 3 and 4-year-olds have access to early learning. Another 50% do not, which is why this bill that I'll be sharing about today was so critical. About 95% of our keiki are actually served through community-based or private programs versus our public programs like Head Start and our public pre-K program. And then total capacity of our licensed childcare slots is just at 23.3% of the total population of children birth to 5. So similar to other states, we had capacity issues pre-COVID, and those capacity issues are shrinking as a result of COVID. So in January of this year, there was a bill that was introduced, Bill 2543, and the goal was to have 100% of our 3 and 4-year-olds having access to early learning opportunities by 2030. It was introduced as part of a package. It was packaged with minimum wage, affordable housing, and a facilities bill. So it's a really nice package to look at how do we support our families in a really wraparound, holistic way. And it had support from the chair of budget and finance, education committee chairs on both the House and Senate side, our business community, and then our early childhood partners. This is where we ran into some issues. So this is how a bill becomes a law in Hawaii, the keiki edition. And we ran into issues right at the beginning. The bill got introduced. It was introduced by the Hawaii Executive Collaborative, which is a body of business CEOs that really started to understand how critically important access to childcare was for the business community. But there were problems with the bill. And I'll speak a little bit about that. The key players, as you can see here, the implementers are in the middle. So we have all of our state departments, our boards, but really the change makers in this and where this is different from previous efforts was the commitment of the legislature and the commitment by the Hawaii Executive Collaborative, or our business community. At the time, before COVID, they had committed significant funds. They said they would match up to 200 million. So the state would put in 200 million. The legislature and HEC would match the state, which we've never seen that type of money being committed, which was really exciting opportunity for everybody. But we ran into some problems. There was lots of issues within the bill. I'd say one of the biggest ones is it would propose to dissolve our Executive Office of Early Learning. So you can imagine the uproar. So we were asked to bring parties together to mend relationships, to strengthen the bill, and to enhance transparency. So we brought all those parties that I just showed together over 2 months to really get the bill to a place that was in a better place to get passed. The tensions were around relationship tensions, so the blame, shame, authority questions. We had substantive tensions around the balance between rapid expansion and quality, 3s and 4s versus infants and toddlers, and our ongoing workforce shortages. And for today's conversation, especially, I wanted to highlight the 6 goals that were in the bill, but specifically the goals around using creative solutions for space. Hawaii is very densely populated, especially on our island, Oahu. And so looking at what spaces can we use? And so we started to get creative with looking at facilities. So we were looking for spaces that are already state funded or currently have space available. Since COVID-19, opportunities for outdoor spaces and business on-site childcare have also emerged. One of the key elements of the bill was looking at libraries. We have the only statewide library system in the nation with 51 branches on 6 islands. There's also, we're looking at Imiloa Astronomy Center in Hilo as a place, it's a museum and it's also a place of learning for school-age kids, but looking at using that space for early childhood as well. The Honolulu Convention Center is underutilized, and so looking at, and centrally located. And then the fourth area was Aloha Stadium, which is a big stadium with a very large parking lot and a lot of opportunity for co-location. Here are some of the big components of the bill. It has shifted now to 2032, given COVID, but implementation of a statewide KEA, requirement of accreditation within the first 7 years of receiving funds, expansion of subsidy, creation of positions, and then the standing up of a Department of Human Services grant program for providers. But then March hit, COVID hit, and the legislative session was stalled. We continued to bring partners together to design the implementation framework and pilots and to advocate for the passing of the bill. Surprisingly, in July, the bill passed. We were so excited. The other bills in the package, facilities bill passed, which stands up a separate facilities agency in the state, and the early learning bill passed. Unfortunately, it didn't pass with any money because Hawaii, as most states, was hit very, very hard financially because we're so dependent on tourism. And so we do have small funds that I'll share just a little bit about. So the current efforts are really focused on planning and also implementation of some immediate pilots. Some of the opportunities we see is this is really the most comprehensive early childhood bill passed in Hawaii. Pathways for implementation, planning can begin. If Biden and Harris win, the bill positions Hawaii for a portion of the $775 million proposed for universal pre-K. We have government and philanthropy commitment, and that's really transformative. Some of the challenges are funding the mandates, potentially further siloing the early care and learning community, meeting expansion and quality benchmarks without jeopardizing either, and then recruitment and retention. And I just want to end on, this year's been an interesting year for everybody. And I think this bill was an interesting one because all great changes are preceded by chaos, and we've known nothing but chaos this year. And it really has highlighted as we try to figure out in Hawaii how to reopen our economy, it's really spotlighted the critical importance of childcare, and we are not going to be able to open our economy without it. And so I do think that that was one of the key reasons that the bill passed, is that extra pressure that was put on the state due to COVID-19. So with that, if there's any questions, I'm happy to answer them.